As healthcare professionals, we are acutely aware of the sun's profound impact on our health, particularly its role in skin cancer development. Our responsibility extends beyond treating existing conditions. It encompasses educating patients about preventative measures, with sunscreen at the forefront. Sunscreen is not merely a cosmetic product. It is a crucial tool in our arsenal against the detrimental effects of ultraviolet (UV) radiation. By integrating sunscreen counseling into our practice, we empower individuals to make informed decisions about their skin health. We can emphasize that daily sunscreen use, regardless of weather conditions or skin tone, is paramount in mitigating the risk of skin cancer and premature aging. Our expertise allows us to guide patients toward appropriate sunscreen choices based on their individual needs and lifestyles. Navigating the world of sunscreens can be overwhelming for patients, often leading to confusion about the different types available. Broadly categorized as chemical and mineral sunscreens, each offers distinct mechanisms of protection. Chemical sunscreens, containing ingredients like oxybenzone and avobenzone, absorb UV rays and convert them into heat, which is then released from the skin. Mineral sunscreens, formulated with zinc oxide or titanium dioxide, function as physical blockers, reflecting UV rays away from the skin's surface. Understanding these mechanisms allows us to effectively communicate the benefits and limitations of each type to our patients. For instance, chemical sunscreens are typically lightweight and blend easily into the skin, while mineral sunscreens provide broad-spectrum protection and are suitable for sensitive skin. Sunscreen's primary indication is straightforward: to protect the skin from the harmful effects of the sun's ultraviolet UV radiation. This encompasses both UVA rays, responsible for premature aging, and UVB rays, the primary culprit behind sunburns. By absorbing or reflecting these rays, sunscreen acts as a barrier, preventing them from penetrating the skin and causing damage. The benefits of consistent sunscreen use extend beyond preventing sunburn and reducing skin cancer risk. Sunscreen plays a crucial role in maintaining an even skin tone, preventing the development of hyperpigmentation, and minimizing the appearance of fine lines and wrinkles. It is an essential component of a comprehensive skincare regimen that promotes overall skin health and preserves a youthful appearance. While sunscreen is generally safe and effective, certain precautions can optimize its benefits and minimize potential risks. Patients should be advised to apply sunscreen liberally and evenly to all exposed skin at least 15 minutes before sun exposure. This allows the sunscreen to form a protective barrier on the skin's surface. Reapplication is equally important, especially after swimming, sweating, or towel drying. Patients should be encouraged to reapply sunscreen every 2 hours, even on cloudy days, as UV rays can penetrate clouds. Furthermore, emphasizing the importance of choosing a sunscreen with a sun protection factor, SPF, of 30 or higher is crucial for adequate protection. Section 5. Sunscreen reactions. Recognizing and addressing adverse effects. While generally well tolerated, sunscreens can occasionally cause adverse effects, particularly in individuals with sensitive skin. These reactions can manifest as allergic contact dermatitis, irritant contact dermatitis, or photoallergic reactions. Allergic contact dermatitis typically presents as an itchy red rash, often accompanied by small blisters. Irritant contact dermatitis, on the other hand, causes burning, stinging, or itching upon application. Photoallergic reactions triggered by sun exposure after sunscreen application can result in a red, itchy rash that may resemble a sunburn. Educating patients on recognizing these reactions and advising them to discontinue use and seek medical attention if necessary is crucial. Section 6. Personalized sun protection. Choosing the right sunscreen for different skin types. Recommending the appropriate sunscreen requires careful consideration of individual skin types. For patients with oily or acne-prone skin, Lightweight, oil-free formulations are ideal to prevent clogged pores and breakouts. Those with dry skin may benefit from moisturizing sunscreens containing hydrating ingredients such as hyaluronic acid or ceramides. Sensitive skin requires gentle, fragrance-free sunscreens formulated with mineral filters like zinc oxide or titanium dioxide. Patients with darker skin tones should be aware that chemical sunscreens can sometimes leave a white cast, making mineral sunscreens a more suitable option. Understanding these nuances allows us to provide tailored recommendations that promote both efficacy and patient satisfaction. Section 7. Sunscreen Contraindications. When to exercise caution. While sunscreen is generally safe for most individuals, certain contraindications warrant caution. Infants under 6 months of age should be kept out of direct sunlight and protected with protective clothing, as their skin is highly sensitive. Patients with known allergies to sunscreen ingredients should carefully review product labels and opt for hypoallergenic formulations. Furthermore, individuals with certain medical conditions, such as lupus or rosacea, may experience exacerbated symptoms with sun exposure. In such cases, consultation with a healthcare professional is crucial to determine the most appropriate sun protection strategy. By understanding these contraindications, we can ensure the safe and effective use of sunscreen in all patient populations. Section 8. The Safety and Efficacy of Sunscreens. Separating Fact from Fiction. The safety and efficacy of sunscreens have been rigorously studied and supported by extensive scientific evidence. Regulatory bodies, such as the Food and Drug Administration in the United States, impose stringent regulations on sunscreen ingredients and labeling to ensure consumer safety. Sunscreens undergo rigorous testing to determine their SPF, broad-spectrum protection, and water resistance. Despite the abundance of scientific evidence, misinformation and concerns regarding sunscreen ingredients persist. It is our responsibility as healthcare professionals to address these concerns with evidence-based information. We can reassure patients that the benefits of sunscreen use far outweigh any potential risks, and that regular sunscreen use remains the cornerstone of skin cancer prevention. Section 9. The Price of Protection. Sunscreen Costs and Considerations. The cost of sunscreen can be a barrier for some patients, potentially hindering consistent use. Generic brands often offer comparable protection to their name brand counterparts at a lower cost. Patients should be encouraged to explore different options and choose a sunscreen that fits their budget without compromising on quality. Furthermore, many insurance plans cover the cost of sunscreen, particularly those prescribed by a healthcare professional. Patients should be informed about potential coverage options and provided with guidance on navigating insurance procedures. By addressing cost concerns and providing accessible solutions, we can empower patients to prioritize their skin health without financial strain. Section 10. Sunscreen. Your first line of defense for healthy, radiant skin. In conclusion, sunscreen stands as an indispensable tool in our collective pursuit of healthy, radiant skin. As healthcare professionals, we are uniquely positioned to advocate for its importance and guide our patients toward making informed decisions about sun protection. By understanding the different types of sunscreens, their indications, precautions, and potential adverse effects, we can provide tailored recommendations that meet individual needs and lifestyles. Let us not underestimate the power of this simple yet effective intervention. Through education, encouragement, and a commitment to dispelling misinformation, we can empower our patients to embrace sunscreen as an integral part of their daily routines, paving the way for a future where healthy, radiant skin is the norm, not the exception. For more information, you can contact Scientific Gulf Index at website www.gulfindex.org.